everyone, my name's Hannah Knoll, and today I'm going to be presenting my Prezi about my research question, does telemedicine work? So just starting off, going into what exactly telemedicine is. I know a lot of times people hear that word being thrown around, especially now with the world circumstance, but you might not know the exact definition of what telemedicine actually means. So going into the formal definition, telemedicine is any way of using technology to treat somebody in a remote setting. So if you've ever done a telemedicine appointment, it involves you using like a secure video system to talk with a doctor, and they will do it securely, so they'll be in a room by themselves, you'll be in a room by yourself at your home, and you'll just answer basic questions like your name, your birthday, weight, and stuff like that, and then you can just have the visit as if you would in person, but over video calls. There are some limitations to that, but we'll get into that further in the presentation. So a lot of the times people hear the word telehealth when they hear telemedicine. Sometimes they're used interchangeably, but they actually do have two separate definitions. Telehealth is just using any form of technology to treat a patient. So this can be done remotely or not remotely, whereas telemedicine is done 100% remotely. So an example of telehealth that wouldn't be telemedicine is a robo-doctor coming in to a patient's room at a hospital and treating them. The patient still is in the hospital, but the doctor is working remotely or working with multiple hospitals, so they're actually just shown on a screen, but the patient is in the hospital themselves. Next, I'm going to show you a short clip that was just published a month or two ago pertaining to telemedicine during coronavirus. This clip just explains a little bit more about how telemedicine is used and in the current circumstances.
If you're worried you've contracted COVID-19, that's the disease caused by the novel coronavirus, don't just rush off and see your doctor, at least not right away. It seems counterintuitive, but health departments across the country are urging people with symptoms to call their doctors instead of heading to an emergency room or urgent care facility. This lets doctors better determine if someone is sick with coronavirus and whether they need testing. In addition, the Centers for Disease Control and the World Health Organization are both encouraging people to use telemedicine options like American Well, GUI, or Doctor on Demand. Many hospitals offer virtual clinics as well. The benefit of calling ahead or going online is twofold. One, it keeps anyone who is sick from spreading their illness, be it the flu, a cold, or coronavirus. And two, it can give physicians and nurses more time to devote to those with more severe symptoms. A new form of telemedicine is being quickly developed and tested in Silicon Valley. Verily is debuting a coronavirus risk screening and testing website. Think of this as digital telemedicine. The online tool will triage people and direct those who are eligible to mobile testing sites. The website leverages Verily's existing health data platforms and was developed in partnership with the state of California. For now, the reach of the project is limited, but Verily intends to eventually scale the capacity as more testing kits and sites become available. Every evaluation for coronavirus starts with basic health questions and a description of symptoms. Next, the patient is asked for biometric data like heart rate and temperature. If one has a fever and an elevated heart rate, that might signal the possibility of developing respiratory distress. For patients with low acuity symptoms, physicians recommend simply monitoring and treating the symptoms. All of the assessment options will help to track those suspected of having coronavirus, so agencies like state health departments and the CDC can monitor the outbreak. Many cases of coronavirus are actually mild or even asymptomatic, making this an unfortunate double-edged sword. An infected person who shows no symptoms and thinks they probably don't need to be tested
that video was just a short clip showing an overview of how telemedicine is being used at this current time, just some advantages and some drawbacks. So going into more of the advantages that there were mentioned, there is a few of them. Just going over the list, more people can be treated quickly, there is less risk of spreading the disease to people in the office, more accessibility to people who live far away or have a disability that makes it hard for them to come in person, and insurance does cover telemedicine the same way as an in-person visit. So all these things make telemedicine a great option, especially like they mentioned in the video, if it's somebody who just has very mild symptoms, whether that's coronavirus, a cold, or any other problem. If they just have really minor symptoms, it's easier for them to stay home than come into the hospital or a doctor's office and potentially infect people that are at higher risk for contracting the illness. And also they could infect nurses, doctors, which means those people would be out of work and not able to serve the people who need more help. Going into how coronavirus can help people with asthma, the Journal of Allergy and Clinical Immunology posted a article about different studies that were done in regards to telemedicine and asthma symptoms. It looked at a bunch of different studies that included using telemedicine in the treatment of asthma, and at the end of the article they concluded that telemedicine can only help the treatment of asthma. So that's linked at the end in citations, and it's a really cool article to look over just to see about how it can help treat other things other than just viruses. And then obviously touching on COVID-19, like mentioned in the video and mentioned before, this obviously is the first time that telemedicine is being used to really widespread. Before it was used, but in a lot of the research that I've done, hospitals are saying like they're using it 10 to 100 times more than they used it before. In one of the articles, I think they said that they're doing around 700 visits, telemedicine visits in a hospital a day, which is a lot more than before. So COVID-19 is kind of bringing up the topic of using telemedicine, and I think a lot of people are expecting this to continue even after the pandemic, that telemedicine is going to be used a lot more. Moving on to some disadvantages of telemedicine, like mentioned in the video, it can be hard to track things like blood pressure, weight, heart rate, if you don't have the appropriate tools at home. I know in one of my telemedicine visits, just a yearly checkup with my doctor, they asked me for my blood pressure, and I don't have a blood pressure cuff at my house. So they instructed me just to go to a local pharmacy and take my blood pressure. But at this time, I don't know if that's necessarily a good option when people are trying to distance themselves. So it can be kind of hard to get the tools you need to give the doctors the correct vitals. And then another struggle that was mentioned in the research is that a lot of the hospitals or doctors' offices aren't equipped with the correct hardware or software. You do need like a secure video system. So a lot of them don't have that specific software, but they're obviously working on that for the future. Like I mentioned before, lack of infrastructure, they don't have the correct software or hardware, so that can be sometimes a struggle in treating patients via telemedicine. And then another disadvantage is that it can be difficult to diagnose. So like I mentioned before, you sometimes can't get all the correct vitals from the person, or if it's a like specific ailment where you would need to see them in person, it can be difficult to diagnose. In some of the research I did, a doctor mentioned that like rashes, tonsillitis, joint problems are very hard to diagnose over telemedicine, because it's usually something where you have to see it in person, and a lot of the times you just can't like see it or feel it over the video screen, so that can be a little bit harder to diagnose. The doctor also mentioned that like the human touch is important in medicine, and you can't really get that over a video call. Moving on to my final thoughts. After all my research, I found that there's both disadvantages and advantages to telemedicine. The disadvantages are definitely less than the advantages. The advantages are higher and more helpful than any of the drawbacks. So I do believe that telemedicine does work and is a good way to treat people that have very mild symptoms and is something that doesn't require being seen in person or like some kind of physical exam. So these are things that could definitely be treated and used after the pandemic as well. And this is just my citations, and that concludes my presentation. I will link the whole Prezi down below, and there will also be a link to the YouTube video if you want to watch it for yourself. Thank you all for watching. Bye.